Thanks very much for joining me. Let's be clear. Our healthcare system today is incredibly broken, dysfunctional, and cruel. 85 million Americans are uninsured or underinsured. We pay the highest prices in the world by far for healthcare. 1 out of 4 Americans can't afford the outrageous prices of prescription drugs. We don't have enough doctors, nurses, dentists, mental health counselors, or other healthcare professionals. Our life expectancy is already far lower than other major countries. Yes, our healthcare system today is already broken. And in my view, in order to remedy that crisis, we have got to do what every other major country on earth does. Not a radical idea, and that is to guarantee healthcare to all people as a human right. But what I have to tell you is that in the midst of all of this, the dysfunctionality of the current healthcare system, Donald Trump and his friends are making a horrific situation even worse. In fact, they are pushing our healthcare system over the edge to the verge of collapse. Now, you think your health insurance costs are high right now? You think you're already paying the highest prices in the world for healthcare? Well, guess what? Within the next couple of weeks, millions of Americans are going to get a letter from their insurance companies telling them that their insurance premiums will double. Let me repeat. As a result of Trump's big, beautiful bill and massive cuts to the Affordable Care Act, your health insurance premiums for 24 million Americans are going to double. And maybe even worse, could get worse. As part of that big, beautiful bill, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 people will die unnecessarily every single year. It's not hard to figure out why. If you're low-income, you're working class, you're sick, you don't have any health insurance, you can't go to a doctor, you can't get into a hospital, you know what? You're going to die. 50,000 people unnecessarily every single year. But it's not just insurance premiums or getting thrown off the health care that you have. As part of these awful cuts, nursing homes in America are going to be decimated. My office has studied some of this. The nursing home situation in America today is a disaster. They're understaffed. And the way we treat the elderly and disabled who are in nursing homes is something we should be ashamed about. But guess what? When 2 out of 3 people in nursing homes are dependent on Medicaid, that situation is going to become much worse. Rural hospitals are going to be hard hit. Republicans like to talk about investing $50 billion into rural health care, but what they somehow forgot to tell you is that their cuts in the bill are $150 billion. In other words, they put $50 billion in after taking $150 billion out. That's a loss of $100 billion for rural health care. Further, we're talking about community health centers. 32 million Americans, all walks of life, get their health care, primary health care, dental care, mental health counseling, low-cost prescription drugs from community health centers. They are going to be decimated as a result of these cuts. So my friends, this is, in my view, what this government shutdown is all about. Republicans want what they call a clean CR. And what that means, for the first time ever, what they want to do is push forward a bill and get it passed without any Democratic input. Now, in the Senate, the rules are clear. They need 60 votes. And what that means always is there has to be bipartisanship. You want 60 votes, you got to have both parties coming together. Republicans are not doing that. They're not negotiating. They're simply saying, take it or leave it, my way or the highway. Well, many of us in Congress are not going to take it. So that is what this whole government shutdown is about. Now, you may not hear much of it from the media, or you may not hear it from most Democrats or Republicans, but that is the simple truth. So let me be as honest as I can be. And that is, I do not intend to vote for legislation that will allow 50,000 Americans to die unnecessarily every single year. ain't going to get my vote. So let me conclude by asking for your help. I can give all the speeches I want. Other members of Congress can give great speeches. They do fine. But what's more important is that my colleagues hear from you. So right now I am asking people all over this country, including you, you, to share your story. I am the ranking member of the Senate Health, Education, Labor, and Pensions Committee, and I want to hear from you as to what a doubling of your health care premiums will mean for you and your family. I want to hear what it will mean if you are one of the 15 million people being thrown off the health care you have because of the massive cuts to Medicaid and the Affordable Care Act. I want to hear from you as to what it will mean if you have a family member in a nursing home and that nursing home has got to cut back on staffing because they don't have the funds or maybe even shut down. What does it mean if you're currently visiting a rural health center, you live near a rural hospital? The time is now for the American people to speak up. So I would very much appreciate hearing from you. Thank you very much.